So we talk about two medical processes, all right, or you could say surgical processes, you know. And anytime you say salping somewhere, just know that they are talking about the fallopian tube, all right. So I don't know why they didn't just name the fallopian tube salping, but anytime they want to talk about medical condition related to the fallopian tube, they use the original name for fallopian tube. So salping is basically, from the Greek word, all right, and it means a trumpet, all right. So the fallopian tube looks like a trumpet, so that's why they call it, initially the salping, but normally you see fallopian tube everywhere and all. So there are two medical conditions that can be done on it: salpingostomy, salpingectomy, all right. So let's just describe them. Salpingostomy is just a surgical opening. It's created in a fallopian tube that can be blocked, all right. Most of the time, maybe to drain it or remove what is blocking it to restore the function of the fallopian tube. If the fallopian tube is blocked, all right, sperm can't pass to meet the egg, so such a woman will be experiencing infertility. The salpingectomy, that one, you surgically remove it. You are removing one side or removing two sides. Several things could make you remove it. It could be pus, it could be inflamed, it could be cancer. You understand? So so when are they used? Salpingostomy is typically performed to treat ectopic pregnancy when the embryo is planted in the tube, all right. So the baby is supposed to come back and implant in the uterus, but when it's implanted in the tube, you can now can you see that this is a baby growing here? Okay, so you just have to open it, remove it, because it will block that area. It can also be done to repair Hydrosalpinx, that's fluid-filled tube. Can also be done to restore fertility in cases of tubal blockage. So salpingectomy is chosen when the tube is severely damaged or ruptured. You can't restore the function, So there's also a high risk of ovarian cancer, permanent contraception. This one, the woman doesn't want to give birth again, so they can still remove her fallopian tubes, all right, and all of that. Okay, so this is it. This should be a salpingectomy, just a unilateral one, all right. So okay, this is just the pros and cons. Okay, salpingostomy, salpingectomy. You can pause to look at it, all right, because our channel is more of like a study, so you can pause to look at it. So fertility impact. So after salpingostomy, natural pregnancy may still occur if the tube heals well. That's after removing the blockage and all. But after unilateral salpingectomy, pregnancy is possible. That's via the other tube. But if you remove the fallopian tubes on two sides, natural pregnancy isn't possible, except they just fertilize the baby outside and they implant it directly into the uterus. You understand? So that's just it for these two medical procedures done.